Hi there, so my name is Kathleen MacKenzie. I'm a urology clinical nurse specialist and I'm based in Rigmore Hospital. So I've been asked to talk about bladder cancer nursing and workforce challenges. So patients with a diagnosis of bladder cancer often face a lifetime of follow-up procedures. So it's important for patients to have a knowledgeable go-to person to support them, and also, for the gaps in between times when they're wondering what's happening and waiting for results and whatnot. So your clinical nurse specialist or your CNS tends to be that person. In an ideal world, every patient with a diagnosis of bladder cancer would have a CNS. We're not quite there yet, but we're getting there. So the role of the bladder cancer CNS is that you build up a therapeutic relationship with the patients, and that's built up over the course of diagnosis, treatment and follow-up. And part of the CNS role also includes carrying out flexible cystoscopy, which is your follow-up for bladder cancer. And as such, the CNS plays a central role at several points in the patient's journey. And many CNSs run the BCG, mitomycin C treatment clinics for bladder cancer. So I did that myself for quite a number of years. So you build up quite a rapport with the patients over the number of years doing that. So it's a natural professional development to progress to learning flexible cystoscopy for bladder cancer follow-up. So the Scottish Government recognised the need to future-proof vital services for bladder cancer patients, and the transferring roles guidance on advanced practice was a document that highlights the requirement for nurses to practice at an advanced level to meet the needs of the NHS Scotland for service demands. So part of the National Endoscopy Recovery Plan, which was spoken about earlier, there was a financial investment in urology diagnostic services made, and that was the six kind of departments that were talked about earlier on that were developed throughout Scotland. And NHS Highland benefited through service development by being one of these departments. So we had, prior to the pandemic, I would love to say that our waiting time for flexible cystoscopy was as good as it is in Edinburgh. We were roughly a 3-month waiting list. During the pandemic, it went up to 5 months, but we're now seeing people within 2 to 5 weeks, which is within target. So we're seeing people much earlier in that journey, which means that yes, we're still in the same position where they have to wait for surgery, for theatre, but at least we're seeing them that bit earlier on in that journey. So that's been a huge boost, certainly for the patients in NHS Highland. Non-medical cystoscopists, usually nurses, play a vital role in improving service efficiency and proficiency, and I personally played a bit of a role in that as well, because I was able to step in where previously, before I learned how to do flexible cystoscopy, if a consultant wasn't available to do the list, you would lose that list. So that would be 10 patients that couldn't be seen on that day. Whereas now I'm able to, I do 2 to 3 lists a week, which means when the consultant's not available, I'll step in and I'll do the list on that day as well. So it means we're not missing out on vital time because of holidays or on call or sickness. So using these funds, the Scottish Access Collaborative, in partnership with National Education for Scotland, which is NES, and Glasgow Caledonia University, supported the development of an advanced practice trainee role for non-medical cystoscopy. So when I learned flexible cystoscopy, it was a 1-day course, and then you did it basically learning on the job, and sometimes you could go a few weeks in between having a list, so you always felt like you were back to starting again. Whereas there's now a 2-year programme which is master's level at when they qualify, and it's a standardised course that's throughout Scotland, which is going to be hugely beneficial for the future. I actually applied to do that course with a view to learning the advanced practice of dithermy, and I somehow found myself actually teaching on the course. Mr. Mariappan here has also been benefiting from his expertise with teaching on some of the programme as well. So nursing workforce challenges faced. Well, we all know there's massive challenges with nursing. There's no getting away from that. Lack of workforce retention, attrition and retirement means that forward planning is essential to safeguard the future. In Scotland, current nursing vacancies at the end of 2022 were 6,319.3 full-time equivalents. That's up 9.7% in the last year. I mean, back when I did my training 20 odd years ago, somebody basically had to retire or die for you to get into a position that you wanted to be. That's no longer the case. This makes it difficult to recruit to specialised areas. With 1 in 4 unfilled vacancies, it leads to unrest and burnout. I mean, burnout, without a shadow of a doubt, is a massive issue with nursing. We no longer have dedicated urology wards to recruit from, where previously staff had embedded knowledge and skills. These skills are now diluted and lost in the general business of ward life. I was very lucky, and when I qualified, it was urology and vascular the ward that I actually worked in, and you grew to love that specialty. You grew to know it inside out, and you were picking up on early warning signs, but you just don't have that experience available in the wards anymore. So that makes it a little bit harder. Nurses are constantly working it with their original job description, and bandings are not reflective of their roles. So this is robbing Peter to pay Paul situation. To train a nurse specialist, you need to steal experienced nurses from the wards. This has resulted in a lack of knowledge in relation to pathways of care in bladder cancer, and even what bladder cancer is. I mean, I quite often go to a ward to see a patient, and you're very much aware that maybe an inexperienced nurse doesn't actually know what they're actually looking after these patients for. Because in the general business, they don't have time to learn it all. They don't have time to learn every single specialty inside out like you would have done in the past. Nurses thus have less of the necessary skills, training and time to spend with patients grappling with a cancer diagnosis and the journey ahead. So that makes it difficult from a patient's perspective. Optimism for the future. Well, a sustainable approach to training and investing in staff can solve the problem. We need to value our nursing workforce and recognise those working at advanced level. My own role is an example of this. I've been working at an advanced level for several years, and I'll finally be rebanded to a band AA at the beginning of this month. But it wasn't an easy process gaining that recognition. There's lots of talk out there about, we must recognise that you're working at all these levels. You try fighting and getting your job description changed to actually reflect what you're doing, and you just get mired in lots of difficulties. But the Scottish Government Transforming Roles document will help standardise and define roles and pay banding without the fight, and that's all about is looking at clinical nurse specialists. It's looking at what they're working, the level they're working at, and actually matching it to what they should be being banded at. So hopefully that will make a big difference. It actually helped me with getting my banding sorted. Our team in Inverness has grown from just 2 of us to 6 full-time equivalent CNSs in the last 5 years. There is value and experience in highly skilled nurses taking over traditional roles to release consultants' time, thus making this more cost-effective. We now have 2 nurses recognised at band AA in our team, which is, that's a massive improvement as far as we're concerned. And working at advanced practice level being recognised. The establishment of standardised training at MSc level is exciting, and it's growing a network of non-medical cystoscopists, mainly nurses throughout Scotland, but we do have somebody who is a physician's assistant on the second cohort of our course this year, so that's quite exciting. It's not just nurses that are learning it. So how can you help? Well, you can help us raise awareness that hematuria or blood in the urine is not normal and should be investigated at the earliest opportunity. Once is enough to ring alarm bells and get to your GP. I'm sure all of us here who carry out flexible cystoscopy are used to having that patient there sort of saying, it's only a one-off, I only saw blood once, I don't know what all the fuss is about, why am I here? And then you find a tumour in the bladder and you're glad that the wife actually kicked them, because it tends to be men that are saying that, and the wives tend to be kicking them to the doctor. Early diagnosis can mean less advanced disease, as already discussed, therefore reduction to the personal burden and also the financial burden on the NHS. We need help driving recruitment to the non-medical cystoscopy course. There were challenges with recruitment to the second cohort. There's only 8 places available, but still with only 8 places we struggled to get them filled. So it's getting awareness out there that that course is actually there and available. We need the whole of Scotland to know this course is available and the benefits of being part of an awarded standardised training. There will be challenges along the way because you have to release staff for study days and training, but we're playing the long game here. We're planning for a sustainable future, a happier workforce and a healthier Scotland. One of the things that quite a number of the students have said is I can't set up my training lists because we're too busy doing other things, but an answer to that as well, if you can't find time to do the training, how are you going to find time to do the actual list that you're going to be doing when you qualify? So it's having that awareness that it's, if you set things in place now, that, the whole department's going to benefit in the future. And that's me.